Leslie Carpenter with Iowa Mental Health Advocacy says that far too often people who struggle with mental illness are released from the hospital without any supports. The practice, she says, is called streeting.
I know of one case where the parents were guardians for their daughter, and she was discharged from the hospital. They were never notified, so they were not there able to help provide support. And who they received a notification from was actually the police. They came to notify them that she had died by suicide.
A bill working its way through the Iowa legislature seeks to change this. When hospitals go to discharge a patient who is involuntarily committed, House File 385 requires that they provide a 15-day supply of medication for that patient. The bill also requires hospitals to provide the patients with paperwork that includes dates and times for follow-up appointments and how to stick with treatment. It also requires hospitals to notify the court and family members that their loved one is set to be released.
It requires an accountability and a responsibility to discharge the person with reasonable communication and care coordination to stop and limit the possibility of that person going back off their medications and out of treatment and deteriorating over and over again.
Thursday, the bill passed out of the Iowa House unanimously.
This bill will help us to pause the revolving door of repeated hospitalizations, to lessen homelessness, incarceration, and victimization of people with severe mental illnesses here in Iowa.
And hopefully this is going to save some lives and aid in the families as they look for other resources in the communities.
Carpenter likens the bill to putting a foot in the revolving door of hospitalizations and homelessness for people who struggle with severe mental illnesses. She now hopes that the Iowa Senate and Governor Kim Reynolds agree. At the Iowa State Capitol, I'm Connor Hendricks reporting.